At Ohio State's College of Public Health, you will become an expert in using data to advance health equity for communities near and far. Prospective students should know that our MPH program in epidemiology is a quantitative program that includes many courses in epidemiologic methods and biostatistics. Students will also take courses that teach them how to use different types of software packages that will allow them to analyze and visualize data.
I chose the College of Public Health at Ohio State because I want to be engaged with the research that they do and get hands-on experience in the field.
I'm really proud of the degree that I received from Ohio State in epidemiology. Now, as a budding researcher, I'm excited to continue to learn and contribute to the field of public health. I've been able to build a strong analytic skill set and apply it in both clinical and academic research settings.
Because Ohio State is a land-grant university, many faculty in the College of Public Health are conducting research that will improve the health and well-being of people right here in Ohio. We have some faculty members who are conducting research in Franklin County and focusing on urban communities, and other faculty who are focused on rural populations in the Appalachian region of the state.
This is a really exciting time to join the field of public health. Being an epidemiologist is not only about being in the background and working with data to investigate questions related to risk factors or prevalence or occurrence, but also in the foreground and having an impact on both practice and policy.
Prospective students should have an interest in identifying and studying vulnerable populations. They should also have an interest in understanding what impacts health at the population level. And finally, they should have a passion for collaborating with other public health professionals in the divisions of environmental health sciences, health behavior, health promotion, health services management and policy, and biostatistics.
I want to use the skills that I've developed in data analysis and research to help address health disparities and improve health outcomes for individuals and communities.